Hello, welcome to Intro presented by DSC SchrDbb. In this tutorial, we're going to visualize ulcers. Now, ulcers, we're going to visualize the ulcers with respect to the SC SchrDbb algorithm, which is the disease. Under the disease, we have the differential diagnosis of ulcers, the endemic disease, you have the cause, you have the complication, and then you have the background, and lastly you have the prognosis. So these are disease on ulcers, and this is going to correspond to the diagram of the mechanism, the pathogenesis, the pathophysiology. Outward, you're going to have the risk factors and the epidemiology, and then lastly you're going to have the follow-up with the prognosis. Okay. Now in this tutorial with the ulcers, you need to know that it's an introduction to the tutorials in the ulcers. Now in the introduction to tutorials in ulcers, you need to know that here we're going to visualize the major types of ulcers. Is it clear? The major types of ulcers can be based on the major structures which are found in a particular compartment. You have arteries in the structure, so you have what is called an arterial ulcer. And the next one, you have vein in the compartment, so you also have venous ulcers. The next one, you have neuropathic ulcers caused by nerves, neuropathic ulcer. The next one, you have malignant ulcers. You have malignant ulcers, and then you also have infected ulcers. Is it clear? So now we are going to visualize the tutorial of each of these types inside the ulcer tutorial. You're going to visualize arterial ulcers, venous ulcers, neuropathic ulcers, malignant ulcers, and you're going to visualize infected ulcers. You have also even other types of ulcers involved again in all these condition. Is it clear? So in the ulcer topic, you're going to visualize all these type of conditions. Is it clear? So that every time that you receive a patient that has an ulcer, that is the way that you have to reason. You reason in the topics of the ulcers, and then you bring out the different topics inside those specific ulcers. So now you're going to continue with the definition, and you're going to visualize of them.